D. Level of consciousness. Non-sedated patients. If your patient is awake and not sedated, use GCS or AVPU to assess level of consciousness and mental state. Ensure pupillary size and reaction is included in your assessment. Identify any new changes in neurological state. New confusion or difficult to wake patients may indicate respiratory issues or deterioration in clinical condition. Ensure at handover it is clear how you have reached your assessment, i.e. eye-opening to pain but only to a firm trapezium muscle squeeze. Sedated patients. You should still assess GCS even if your patient is sedated. However, there will not be a verbal response as your patient will be unable to talk. The GCS score in ITU is modified to allow for this. Include pupillary size and reaction in your assessment. If your patient is sedated, it is more important to assess the level at which your patient is sedated. You may use the Richmond Agitation Assessment Scale. Other assessment scales may be used. Check local guidelines. This must be done at the beginning of your shift as part of your assessment. Ongoing assessment of sedation through the shift is also necessary as requirements and aims of sedation level may change. These are often set out by the ITU medical team. Once an assessment of sedation level is made, any clinical change or deterioration in neurology can more easily be identified. Sedation may be altered to target the level of sedation required if needed. The reasons patients are sedated include to facilitate ventilation, relief of anxiety, management of acute confusional states, implementation of treatment or diagnostic procedures, reduction of the physiological stress response. It is important that your ventilated patients with endotracheal tubes are adequately sedated, as patients can quickly wake up and attempt to remove tubes. This can be especially true of younger patients who often require higher levels of sedation. Ensure all syringe drivers with sedation are checked thoroughly. Check rate and dose. Ensure replacement syringes are ready to replace. If sedation abruptly stops, some drugs will have a very short half-life, which means the mode of action will stop almost immediately. These patients will therefore wake up and be frightened, disorientated, which will lead to unplanned extubations or high levels of patient distress. Drugs. Commonly used drugs for sedating patients include propofol, an anaesthetic agent, morphine, an opiate, midazolam, a benzodiazepine, fentanyl, a synthetic opiate, atracurium, a muscle relaxant. Each trust may use a slight variation of sedation. Check your local guidelines. For some ITU patients, an infusion of muscle relaxant may be required to aid ventilation. It is vital to ensure if muscle relaxant is used, the patient is adequately sedated to avoid unnecessary stress, awareness, and long-term PTSD. This can be assessed using a train of 4 method. This will be undertaken by the ITU nurse. Blood sugar levels. ITU patients often require an insulin infusion to keep blood sugar glucose levels between 4 and 10 millimoles. There has been lots of research over the years to support preventing hyperglycemia in critically unwell patients. Therefore, you may find your patient is on an insulin infusion but may not be diabetic. It is important to check blood sugar levels frequently as outlined in the local guidelines. It will be more difficult to spot the hypoglycemic patient in sedated patients. Pain. Assessment of pain in critically unwell patients is vital. Pain can indicate new or evolving clinical conditions, i.e. an MI, acute abdomens, or new infection. Pain is more difficult to identify in sedated patients, so consider pain when there are physiological stress responses. A critical care pain observation tool may be used to assess pain. This is based on 4 domains: facial expression, body movements, ventilator compliance, muscle tension. If pain is suspected, appropriate analgesia should be used. Although most ventilated patients will already be receiving a sedative and analgesic agent, these can possibly be increased or bolused if appropriate. A reassessment of pain should then be made.